All right. So, hey, welcome everyone to this LinkedIn Live edition of Make Work Awesome. And today I'm super excited to have with me Mario Toruno, who is the Vice President of Digital Health Solutions and Strategy at Nolij Consulting. Mario is a great friend and a technology thought leader who drives the culture of innovation in the healthcare space. Mario, it's really exciting to have you with us today, and welcome to this session. Please tell us a little bit about yourself and your current roles and responsibilities at Knowledge Consulting.
Yeah, Sahil, thanks for having me on Make Work Awesome. Excited to be here. So, what I do today, I'm actually serve as the Vice President of Digital Health Solutions and Strategy. And what I really end up doing is I use technology and I find partners to pretty much create a better health outcome, right, for patients. So, my whole goal is to help the patients and the providers provide better care and patients have better outcomes and do that through technology and find the right partners, the right positions, things of that sort, right?
Absolutely. Thank you so much, Mario. And there's something really interesting that I noticed on your LinkedIn. Where you've mentioned that you believe in using technology to make the world a happier place. So, just wanted to learn from you, like, how do you see technology bringing a difference to the healthcare industry, both from a patient-facing as well as the employees and the caregivers' perspective?
Yeah, so definitely on my LinkedIn you do see that, right? So you see, if anything, that's my slogan, if you will, right? Using technology to make the world a happier place. Now,
Mhm.
I'm a strategist and a technologist, so it's about connecting the dots, if you will, right? So if we were to look at it from a story perspective, I'll give you an example, right? A patient who has diabetes cannot use the device to track their glucose, right? Now
Mhm.
that device enables them to get direct information to provide better care for themselves, right? Now, from the provider perspective, that information can then be fed into the clinical systems,
Mhm.
right? And then the provider now captures alerts and real-time data on the patients that they're monitoring, right? So in turn, they can provide better care as well, right? So this is like one instance, using diabetes, but as time goes on, right, this will become very normal among many conditions.
Absolutely. No, absolutely, Mario. So, I mean, do you think traditionally the healthcare organizations, and especially on the provider side, right? I mean, have they been slow to adopt these digital technologies? And do you see any shift, post COVID-19?
So I do think that healthcare in general is slow to adopt in the past. That's rapidly changed. A little
Mhm.
bit prior to COVID-19, but definitely COVID-19 pushed it, right?
Mhm.
So, for example, before we weren't thinking about RPM, right? We weren't thinking about telehealth. We weren't thinking about those things, although we knew those things could be provided, right?
Mhm.
Now we
Mhm.
are, right?
Yeah.
So from that perspective, what do you need? Right? You need technology, right? Kind of like the use case or the story that I just told prior, right?
Mhm.
Think of it now in that perspective, right? COVID-19 now enables remote patient monitoring, right?
Absolutely.
Now enables telehealth visits, right?
Mhm.
And then like if you look at it from like an investment funding perspective, the healthcare sector has had massive amounts of funding. I know
Mhm.
I read a story not too long ago on from Rock Health where they were saying that it's I think tripled or doubled in the past year, right, from the
Mhm.
year prior to like $29.1 billion in investments,
Mhm.
right? So I think from that perspective, it's very clear that adoption is now really, really taking off from a from a healthcare industry perspective.
Absolutely. Absolutely. So, we are talking like massive investments in this space, like billion-dollar investments coming in from the healthcare providers and payer side. But I think, with that coming in, one of the biggest reasons that has been attributed to the failure of these digital transformation projects is poor training and onboarding for the users, right? I mean, people like clinicians, nurses who are supposed to work on these applications. So, what's your view on this thing? Like, how do these companies or these healthcare providers mitigate these risks, like mitigate the risk of poor onboarding and get their people ramped up faster on the new technologies that are being brought in?
Sure. So I think when you're introduced to a new healthcare system, right, whether it's a whole migration, right, overhaul from like maybe an Epic or Cerner or vice versa,
Hmm.
to just a new function, right? Training needs to occur. The physicians or the clinicians need to understand what they need to do. And I think that's where digital enablement plays a huge piece, right?
Hmm.
Being able to implement technologies that can train and teach
Hmm.
way beyond the
Absolutely.
training that they receive, right? So, for example, training is great, but a lot of times it does when it stops with training, people tend to forget, right? So
Exactly.
how do we actually fix that, or how do we approach that? And that's where digital enablement technologies come into play, right? Where they can continuously reinforce the training, right,
Hmm.
and create a positive impact. Because at the end of the day, whether it's people that are there at the health system or people that have
Hmm.
come from other health systems into that health system,
Yeah.
workflows is really what matters here, right? And
Absolutely.
this is where enablement really can help, right? Ensuring that
Hmm.
the right workflows occur and the way it's done is done according to the system and the culture of the hospital, right? Or the clinician group, or whatever you have.
Absolutely. Absolutely. I think, wonderful. I think that's going to be like, that was going to be my next thing, like, because the caregivers, especially nurses, physicians, they're like always busy taking care of patients, right? I mean, like some of them must be using like 10 plus applications in their day-to-day
Mhm.
jobs, to get the work done. And how would they get time to be trained, right? I mean, either you look after patients or you like, spend times in the classrooms getting trained. So I think that's a great perspective, Mario, that you mentioned, right? About getting the in the flow kind of training and like assistance when they're using these applications. So one thing there is regarding the like while we talk about training and using these applications, the other thing is like the accuracy of data thing, right? I mean, there are so many areas where people have to keep entering data in the applications that they use and make sure that the entire process is carried out or conducted in a completely accurate manner to avoid any kind of errors. And then it also boils down to the integrity of data in the broader healthcare ecosystem, right? So because any kind of inaccuracies can definitely put people's lives in dangers. It's in fact attributed like 86% of mistakes in the healthcare industry are administrative, and some of these do lead to death of patients as well. So how do you see AI and automation coming together and helping these healthcare providers to resolve these challenges?
So I think that AI and automation, be it RPA or intelligent automation, backed with AI, is tremendously helpful in these areas,
Hmm.
right? AI allows us to leverage, NLP, right, or computer vision type things,
Absolutely.
in order to look at EHRs, right?
Hmm.
In order to look at medical notes, right?
Hmm.
Which then what does that do? That creates cleaner data, right? That creates better data, right? So if you go back to the connecting the dots, as I talked about earlier, right? So now that we are using these technologies, right, and the data is cleaner, now
Hmm.
the AI algorithms behind data analysis, right, and data analytics can now take a better stance on what's there, right? And they can drive the 86% to hopefully become less than that, right?
Absolutely.
Through all these technologies being integrated together from an intelligent automation perspective, as well as from an AI perspective in reading the data and all those aspects.
Mhm. Absolutely, Mario. And like apart from these things, are there any other top, two or three use cases that kind of cross your mind when it comes to deploying these technologies in the healthcare space, either from a patient perspective or from the back office perspective in the healthcare industry?
Yeah, I mean, for example, and we're kind of seeing it more and more now, right? Where we're using these types of technologies for scheduling,
Hmm.
ensuring like there's a lot of money lost in systems because people don't show up to their appointments,
Oh,
right?
absolutely.
And a lot of it's because they forgot. It's
Mhm.
not that they don't mean they meant to, they just forgot,
Oh,
right?
absolutely.
So using an intelligent automation and RPA allows that to close, right? Allows us to say, okay, make sure that we text patient X to be here on this day at this time, right? And
Hmm.
send a reminder, right? So that
Yeah,
that reminder that had, that scheduling that happened 3 months ago or 4 months ago, the people are going to forget that, but the
absolutely.
reminder helps close that gap, right?
Mhm.
Thinking about another side of it, right? As we continue to go further and talking about like workflows, using these types of technologies for discharge, right?
Mhm.
Being able to automatically print, patient notes, being able to print, right? Patient education, things of that sort, I think goes a very long way as well.
Absolutely. No, thank you, Mario, for sharing these insights. And I'd like to really thank you for your time today. It's been a wonderful conversation. Catching up with you about the innovations that we can bring in the healthcare industry. Any last bit of advice that you would like to share with the IT and business leaders in the healthcare space?
So I would say that, and when I talk to a lot of people, I refer to a quote from Einstein, pretty much saying that logic gets us from A to B, but our imagination takes us everywhere. And I
Mhm.
think in our industry, in our space, especially as technologists, futurists, whatever we want to call ourselves, we really need to use our imagination, right?
Abs-
Use that imagination to create those further impacts, to think outside the box,
mhm.
right? Using these technologies coupled with that, I think is a very powerful tool within the healthcare industry. And it will only create positive outcomes throughout.
Absolutely. No, thank you. Thank you so much, Mario.
All
Thank you.
right,
Have a
thank you,
great day
Sahil.
ahead. Thank you. Bye bye.
See you.